Good morning, everyone. It's Friday the 12th of June. I hope everyone's well. This webinar is being recorded and will be available later this morning as well. I hope everyone's well. So I've got quite a lot of updates to give people today, so I'm just going to go through all of those. I think the first biggest thing that's really come up at the moment is about track and trace. And you'll be aware that the government launched the NHS track and trace service last week to minimise sort of community transmission of COVID-19. And really, it's to notify those that have been in contact with somebody that they should be self-isolating at home for 14 days. So what does that mean for us in primary care? So certainly if a member of our staff develops symptoms of COVID-19, they should stay at home and follow the official guidance and get tested as soon as possible. And if the result is negative, and the advice from Public Health England states that they can return to work when medically fit to do so, following a discussion with their line manager and any sort of local risk assessment that we need to do in practices. But what's really important is that we interpret negative results with caution together with clinical assessment, because as we know, there can be a false negative. And what's really important is if they test positive, they can return to after, we still say 7 days, unless they have symptoms other than or loss of smell or taste, in which case they must continue to isolate until they feel better. So when a member of staff, an NHS member of staff, of course, test positive for coronavirus, they start the point that is test and trace self-isolation applies just as it would for anyone who's a non-NHS member of staff. So there's no differentiation in the rules for whether you're a member of public or an NHS staff. And that's really important. So if a healthcare professional or any member of your team in the practice is contacted by track and trace service and advised to self-isolate for 14 days, they must do so. And there should be a process where they can tell somebody in the practice that they've been contacted. So there's lots of questions that have come up about actually what if that member of staff tested positive for their antibody? What does that mean? Because that means they've potentially had it. Should they still self-isolate? And the current answer is yes, because we don't know whether they're immune, so they should still follow self-isolation. But of course, as we find out more information about COVID-19 and antibody testing, that could change. But currently the advice is the same, and that's really, really important to know. But it's also really important to know that other staff members that they're working around don't necessarily need to self-isolate unless they've been told to by track and trace. So I think the key messages here are that everyone should have a named contact that staff should inform if they've been contacted by test and trace and have been advised to self-isolate. And this point of contact should operate throughout the day. The government has recommended 16 hours of availability, and that can just be, you have a text message that your member of staff sends you and you might call them the next day. We're also thinking about how we might prepare ourselves for staff absence. And what about our business continuity plans? Because there's really important things as well to absolutely be aware of. And so we need to be thinking about that as well. And then the final thing is update your sit rep. So if you have a significant staff shortage, you should let the CCG know, and you normally send the emails to Fraser, and then we update the sit rep accordingly. And we contact you if you're a practice who's really having issues. So as Charlotte mentioned, masks, I'm just going to come on to that next, because as we know, the Secretary of State for Health and Social Care said that from the 15th of June, the recommendation that all staff in hospitals should wear a surgical mask when not in PPE or in a part of a facility that is COVID secure. The guidance actually is going to apply to healthcare in any setting, including primary care. And we're expecting guidance probably early next week by Public Health England, if not even tonight. What does this mean? It's likely, and we don't know yet, that we should encourage staff to wear face coverings whilst at work. And certainly you should all be wearing PPE when seeing patients. Now, face coverings are different to sort of face masks. So face coverings is something that simply cover the mouth and the nose. And it's not the same as a surgical face mask. So I think this is something that's probably going to be announced next week, and I think we should watch this space. It doesn't mean that I'm suggesting to you today that is the new guidance, but what I'm saying to you is that there is a new guidance coming out likely today or next week, and we should really be aware and watching out for that. And certainly we're thinking in my practice, what does that mean? Should we be, getting face coverings for staff? It's really difficult to know. So I think we need some more guidelines there. And I know Ms has said that He thinks there's an exclusion in the guidelines for practice can confidently say that all their staff are following social distancing. I think that's right, but I think we just need to get the final guidance later this week or next week. And then Lyndon, you've asked a question about, did I say that you must social isolate if an antibody positive? No. This is just for track and trace or test and track. You should be isolating. You shouldn't isolate if anyone tests positive for antibodies. So just to remind everyone that priority remains for primary care staff and not currently available for patients at the moment for antibody testing. I've had lots of questions about, could you test somebody with an antibody if it would change the clinical management of a patient? And I think the answer to that is yes, the indication if it were deemed reasonable. But I would expect really, really low numbers, and probably in a large practice like mine, for example, we might have, one every couple of weeks, because we're not seeing a huge number of patients like that. So we are talking about really a dozen across Barnet for those kind of patients. But as I said, priority remains for staff at the moment to get tested. And once all of NCL staff have been tested, NCL will decide whether and what is the right process to roll this out for patients, certainly. The next thing I wanted to highlight to you is about pulse oximetry. There's a new publication that came out yesterday, which talks about pulse oximetry to detect early deterioration of patients with COVID-19 in primary care. And really what we know is that patients most at risk of poor outcomes are identified by oxygen levels. And the use of oximetry to monitor and identify silent hypoxia and rapid patient deterioration is recommended. And thankfully in Barnet, we've always had the volunteers and the SATS probe initiative, which has been fantastic. But what we can really just remind everyone from this publication is that earlier on, doing oximetry, of course, under the supervision of a GP or clinician, is used to pick up desaturations for better early identification of those significant risk of deterioration. And really, particularly for the silent hypoxia. So, and actually, you can get low oxygen levels in the absence of shortness of breath, and I think that's really, really, really important to know and be aware of. And what we can say is that if you've got somebody who's less than 93%, that is, quite a worrying oxygen saturations. But what they're suggesting people to do is do the 40-step walk. So that is get someone to walk 40 steps and then do their SATs, and then the 1 minute sit to stand. And there's information in the guidance about that. So I think it's a really good article to read about. And what's also really important is that just thinking about other things that can cause hypoxia, like peas and things. And there's also been some clear guidance about, if SATs are less than 92 or less, or respiratory rates 25 and above, or a heart rate's 131, then that's a red flag and severe, and they should be going to hospital. And also linked to that, they're likely to have breathlessness, myalgia, chills and fatigue. And then they classify the moderate risk in that group, and that's the sort of 93, 94, 95 oxygen SATs, respiratory rate 21 to 24, and heart rate under 130. So there's a good article on that, and I think it's worth reading. And the next update I wanted to give you was about Consultant Connect. And I'm really pleased to tell you that next week we've got the cardiology team at Barnet Hospital joining Consultant Connect as a pilot week. So from next Tuesday, I'm hoping they will be able to answer calls Monday to Friday from 9 AM to 6 PM. So there'll be 3 Barnet consultants from cardiology going on the rota. But I will update you on Tuesday's webinar with further details on that. And what that certainly means that you can speak to them within sort of 60 seconds on Consultant Connect. It also means that you can send them things like ECGs or any other diagnostic reports like echoes of things from the desktop version. And talking of ECGs, I've had a lot of questions last week about when is direct access to ECG becoming available, and I asked that question to the Royal Free yesterday during our 2-hour meeting, and they said that they're hoping to get that reinstated in the next 2 weeks. And again, I'll keep you updated. And the final thing that we discussed yesterday in the cardiology meeting was a rapid access chest pain clinic and how that might change as we return to business as usual. And what we're certainly talking about is whether Consultant Connect could be a way to integrate this. And what we're talking about right now is whether if you thought somebody needed rapid access chest pain clinic, you'd talk to a consultant on the Consultant Connect and together come up with a plan that's right for the patient and get that patient booked in. But I'll keep you updated, and hopefully that is something that is coming in a few weeks. The final thing I wanted to just quickly talk to you about this morning was about restoration of cervical screening invitations. And on the 8th of June, a regional cervical screening update letter was sent from Liz Wise, who's the Director of Primary Care and Public Health Commissioning. And the letter kind of talks about that we should review our local records or use sort of our final non-responder list to identify individuals whose screening may have been affected by COVID-19. For example, their appointment didn't go ahead and needs to be rebooked, or where it isn't possible to offer an appointment due to the pandemic response, or where they have not responded to a reminder letter and we should be proactively contacting them about screening and giving them the opportunity to attend. And the final thing about that is actually where we've said actually they haven't had their smear because of COVID, we can no longer use that as a valid reason on the notes. And that's really important. And finally, if you've got any problems with collections, you can email the lab, and that is couriers@tdlpathology.com. So that's couriers@tdlpathology.com, or call the lab, and I'll give you the number here on the webinar. It's 0207 307 7373. That's 0207 307 7373 if there's been any problems with collections with smears. I'm just going to look at the questions, and I've had a few questions. What are the guidelines for GPs, staff wearing masks but not in the surgery? So Patrick, I'm going to come back to you on that one next week when we get further guidance. Sorry guys, it looks like I got disconnected there, apologies. So I'm just absolutely going to share the paper with you on silent hypoxia. And then with Consultant Connect on desktops, really straightforward. You just go on to www.consultantconnect.org.uk and you use the same sign-in details that you have been doing for your app. And if you've forgotten that, just click the forgot my password. So it's exactly the same as your app password. So it's consultantconnect.org.uk, and you can sign on and do that. If there's any other questions, do let me know in the chat bar. The final thing is I'm just going to send you a link to the document that everyone's asked for. So I'm just going to put that in the chat bar now. And if there's any other questions, do let me know. Otherwise, I will see you all on Tuesday's webinar, and apologies for the technical issues during this one, and I'll see you on Tuesday, everyone. Have a good weekend, and I'll see you all next week.
Thanks very much. Thank you.
Thanks, everyone.